Well, here we are with two people doing very important clinical trial research for survivors of bowel cancer, and they're both involved with the University of Adelaide. Could you begin and introduce yourself, please?
Hello, my name is Eva Moore. I'm doing research in health and medical sciences. And in this trial, I'll be the one delivering the treatment. So whoever come in will spend a lot of time with me.
And you're both delivering the treatment, also interviewing the patients receiving it as well, isn't that's correct?
Yeah.
They're fantastic. And can you tell us who you are and what your role is in the trial?
Yeah, my name's Cass Gordon. I am the trial coordinator and research nurse.
And what's your role? What do you practically do for the trial?
So my role is a lot of patient contact, a lot of recruiting and getting patients on board. Also, once they're in the trial, it's my job to help Eva, who will be doing the treatment. I'll be helping with the assessments. I kind of write the forms to assess, doing a lot of the paperwork, but a lot of the patient care as well.
Okay, and it's my understanding that you are still recruiting. So as people watch this, if they're interested, we'll have contact details at the radio.
100%, definitely still recruiting.
Fantastic. So in a nutshell, what is the purpose of this trial, and what are you hoping the potential benefits for survivors of bowel cancer?
So people who undergo bowel cancer treatment, more than 80% of them experience chemotherapy-induced peripheral neuropathy. So the anti-cancer agent called oxaliplatin that many bowel cancer patients use, very useful, very effective in combating cancer, but also highly neurotoxic.
And what's the physical effect, if you could explain that term?
So what happens is that oxaliplatin, once ingested, it can actually climb up and go into the cell bodies of the sensory neurons. So after that, people would experience weird sensations such as tingling, numbness. Some people experience lots of sensation. I've got patients describing to me that it's as if they're walking on mattress or foam. They can't really feel the floor. And also pain, of course.
And this is in the feet and also in the hands, as I understand.
Yes.
And so what is the treatment that you're trialling that you hope will reduce this level of pain?
So we're looking at transcranial magnetic stimulation. So when I do the treatment, I will use a figure-8 coil placed on the head, and the region that we're targeting is the region responsible for processing sensory information. And that region is also connected with a lot of other cortices for pain modulation, for example, and for the emotional and memory aspects of pain or sensory issues. So that by stimulating that region, we're hoping to regulate sensory processing.
We're showing pictures of you having this done to you, or not with the machine turned on, so people can see. Does the patient feel anything while you're delivering this treatment to the head? And are there any side effects from the treatment?
No, they don't actually feel anything except for a gentle tap on the head is completely non-invasive and painless. And there are no known side effects. In fact, we've done a lot of treatments in both healthy and clinical population in the lab for many, many years. No side effects at all.
Okay. And I was just going to ask you, how many patients have you recruited so far, and how many do you hope to recruit?
We have currently enrolled 7 patients, but we're hoping to get 40.
And when the results have been analysed, will you seek to publish them? I'm thinking people will be watching this, both patients and patient advocates, but perhaps fellow researchers. How would people learn about the results once the trial is completed?
So we will definitely publish our results in open access journals, meaning that you don't have to go behind a paywall to see it. And also we're thinking of publishing in simple language for non-academics to understand.
We're always grateful for that, so thank you. Is there anything else that you would like to tell survivors of bowel cancer who might be watching this, or fellow researchers? Are there any other key messages about this research that you'd like to share with our audience?
I would like to really tell people who are suffering from chemotherapy-induced peripheral neuropathy that I read and write a lot about it, and I understand how debilitating these symptoms can be, and we are really hopeful that our treatment can make a meaningful difference to them. So if you are experiencing these symptoms and you need some help, feel free to give me an email or a call. We can chat about your symptoms and I can answer any questions you may have.
And what would be your key message to your fellow researchers? And I would like to note that the Australian newspaper a few days ago published an article about this clinical trial, calling it a world first. So what's your message to your fellow researchers?
So chemotherapy-induced peripheral neuropathy, the pain associated with this type of neuropathy, is unfortunately treatment resistant. There are no effective treatments for it right now, and what we're looking at is really the first potential management option for this debilitating neuropathy.
So its significance is that it could provide, if this clinical trial is successful, pain relief and emotional support to a very large number of bowel cancer survivors.
Yes, exactly. So as the saying goes, what fires together, wires together. So with repeated activation of the neural pathway through our repetitive treatments, we have 4 sessions of treatment in total. And we're hoping that this neural pathway can be strengthened and stabilized, providing long-lasting or even permanent relief.
Is it a kind of electricity that you're transmitting to the brain?
Not exactly. So the coil produces an electromagnetic field, and this field will induce neuronal discharge, meaning your brain cells will fire in response to the field.
And we should reassure potential patients joining this clinical trial that both the Australian and the United States bodies responsible for declaring treatments safe have declared this treatment safe. You know, it's the Therapeutic Goods Administration in in Australia, and I think is it the Food and Drug Administration in the United States. Well, what is the significance of them agreeing to the use of this treatment?
So, in a sense, both the efficacy and safety profiles are confirmed. It's now under Medicare rebate for treatment-resistant depression. And yes, we're hoping that our patients can get some side benefits for depressive symptoms too.
Well, look, thank you both very, very much. It's just been fantastic to talk to you. Do you want to wave to our people? Thank you.